Our daytime cardiologist, Dr. Shoba, is here this morning to discuss how kidney disease can lead to other issues related to overall heart health. Welcome, Dr. Shoba. Appreciate you being here.
Good to be here.
There is a correlation there between both organs, both the kidneys and the heart.
Absolutely. In fact, the two major conditions, high blood pressure and diabetes, that cause heart damage and heart failure, also cause kidney damage and kidney failure. So if your heart is hurt, it can hurt your kidneys. And if your kidneys are in kidney failure, it can cause congestive heart failure. Our kidneys, we got two kidneys.
Right.
They do a lot of different things, not just filter out the toxins. They also control our blood pressure. They release a hormone, renin, that controls our blood pressure. If you have a tightly blocked artery in the kidney, it can cause very high blood pressures that are hard to control, and you can do a balloon or stent or something like that to the kidney arteries and the blood pressure will come down. Also, the kidneys regulate our bones, the minerals. They also affect our blood count, our anemia status. So our kidneys do a lot of functions in our body. Kidney disease, unfortunately, is like a silent killer. About 14% of the population, the prevalence is about 14% chronic kidney disease, and people don't even know they have it. A simple blood test and a urine test to look for protein in the urine can tell you if you've got kidney problems or not.
How often should you do that test?
I think when you go to your medical doctor for your annual checkup, that is generally part of your routine workup, and they'll check your blood work and your kidneys. Now also, you can spill sugar in your urine, but if you spill protein in your urine, it's called microalbuminuria. It's a very early sign of kidney damage.
And what are some of the steps that we can take? I mean, we've talked about heart health on here, and cutting back on the smoking. And is it some of the same things taking care of your heart that's taking care of your kidneys?
Absolutely. It's the same risk factors that damage your heart that also damage the kidneys. In fact, some of the medications that you're on, like all these non-steroidals that are available for joint pains over the counter, they hurt your heart. They also hurt your kidneys. Some antibiotics can hurt your kidneys. So there are a lot of medications that you take without knowing it, supplements that you take that can hurt your kidneys as well.
And also making sure you're hydrated. I mean, making sure you get plenty of water.
Correct. When you're dehydrated, the kidneys suffer big time.
And let's switch gears just a little bit, because this is National Stroke Month. And the last time you were here, we were talking about stroke, but it's important information that we need to get folks out there. The word fast.
That's
it is very important that folks learn that the facial, the arm, the speech, the time. I mean, talk to us about that.
Right. Stroke can present in different ways. If you have facial drooping, your arm or leg gets numb, or your speech is slurry. In fact, if you have a little confusion, you have dizziness, your words are not coming out right, people don't understand, what you're saying. Arm numbness, don't blame it off on, arm going to sleep or things like that. Be proactive. Don't think you've had too much alcohol the night before, that's why your speech is slurred. Things that we think of and try to brush it off, those could be all signs of strokes. If you have a severe clapping headache, don't break it off on, oh, it's my migraines, I'm tense. No, it could be a sign of a bleed in the brain. So please be very careful. Important to call 911, because if you're within that 3 to 4 to 6 hour window, there are things that can be done. We can give you blood thinners to break open the clot. We can go in with a little tube and suck the clot out or bust the clot out. So there are things that can be done if you're in the time frame to reverse the stroke, because once you have a stroke, it's permanent damage.
Right. And that time is of the essence here.
Yes.
It really is. I mean, we can't stress how much it is to get that help immediately.
Oh, absolutely.
And let's talk, do you think that, you mentioned it there, do you think a lot of people when they have these symptoms of stroke just play it off?
Yes.
They try to say, oh, it's nothing.
Correct. Those are called TIAs because these symptoms come and go.
Right. You
get a little dizzy or nauseated, you brush it off, your arm is numb, you kind of brush it off. Those are TIAs or warning signs that can be leading up to a stroke.
And you got to listen to your body.
You have to listen to your body. If your symptoms are not going away, that is serious. Or if they're recurrent, it is serious.
All right. Thank you so much.
Thank you very much.
As always, great information. Check out the website right there at the bottom of the screen, or give that number a call for more information, and make sure you listen to the signs that your body's telling you.